Good morning to Dr. Aisha, my dear friends. Me, myself, Lilawatiana Murugan, with my partner Kausalya Devi. We're going to present our case study mini project entitled Treatment Resistant Depression of Pharmacological Approach. Introduction to treatment resistant depression. So, a major depressive illness that fails to react appropriately at least two separate antidepressant treatment of appropriate dosage and duration is known as treatment-resistant depression, which is TRD. This is a common illness that affects 20 to 30% of people who are diagnosed with depressions. It presents serious difficulties for both patients and therapists. The conventional pharmaceutical approach consists of enhancing existing therapies, transferring antidepressants, supplementing with extra medication, and investigating new compounds. Achieving remission or notable reduction in symptoms is the goal, as it is improving the effectiveness of antidepressant treatment. So, for our topic, we choose two articles. So, the article 1 is the efficacy of novel therapeutic agents for the management of treatment-resistant depression, a systemic review and network meta-analysis. So, um, the background of the treatment approach on this article is the effectiveness of several innovative treatment drugs for TRD, such as ketamine and esketamine, and atypical antipsychotics is assessed in the study. So the goal is to identify the therapies that offer patients who have not responded to conventional antidepressant the greatest degree of relief. Here is the general mechanism and main principle of the approach, which is ketamine and esketamine. They function as NMDA receptor antagonists, which causes a spike in glutamate release and consequently increases the synaptic plasticity. This is thought to be one of the reasons behind the quick onset of their antidepressant effect. And another mechanism of this approach is atypical antipsychotics. They are usually used as augmentation drugs, that means they increase the antidepressant effect by modulating serotonin and dopamine receptor. Here's the potential source of bias. So we have five types of bias, which is selection bias, performance bias, detection bias, attrition bias, and reporting bias. As for selection bias, to reduce selection bias, randomized controlled trials, which is RCT, were employed. For the performance, by using double-blind design, performance bias was lessened. Blinding, however, can be difficult, particularly when using medications like ketamine that have pronounced side effects. For detection of bias, to reduce detection bias, outcome assessors were blinded to treatment allocation. Although attrition was managed by intention to treat analysis, bias may still be introduced by high dropout rates in the long term of follow-ups. And lastly, reporting bias. For extensive literature searches was conducted to address publication bias using, when possible, an unpublished data. Followed by the limitation of this article, which is three types of limitations, which is focus on the short term, heterogeneity, and side effects. For focus on short term, the meta-analysis contain a large number of short-term studies with scant information on long-term safety and efficacy. For heterogeneity, difference in patient population, study method, and outcome measures may have an impact on how comparable the findings are. Lastly, the side effects. For new treatments, safety profiles are still being determined, particularly when used over an extended of period time. For areas for future research, there is long-term efficacy and safety, biomarkers, and comparative effectiveness as our discussion here. For long-term efficacy and safety, additional research is required to evaluate the innovative treatments for long-term effects. As for the biomarkers, finding biomarkers will help in more accurate treatment response prediction. Lastly, a straight-up evaluation of several innovative therapies and augmentation tactics. As for the Article 1, clinically meaningful effects is for patient with TRD, which is treatment-resistant depression. The therapies under evaluation of ketamine and esketamine in particular to show quick, significant antidepressant effect. I'm passing the next article to my partner Kausi to explain more on the article number 2.
Hi, I'm Kausi here. I'm going to study about the Article 2, Medication Argumentation after the failure of SSRS by Trivedi 2006. Article 2, Background of the Treatment Approach. This study looks the argumentation options for the people do not react for the selective SSRS and atypical antiprotecus, lithium, and the thyroid hormones are the all often used argumentation drugs. Article 2, the general mechanism and the main principle of the approach. There are three types: thyroid hormones, lithium, and atypical apoptosis. Enhance the efficacy of the uh, antidepressant by altering neurotransmitter production. Lithium modulates the transmitter release and has the neuro neuroprotective qualities, atypical activities, and the serotonin and dopaminergic transmission. Article 2, potential source of bias. There are four types: selection bias, performance bias, detection bias, article bias, and reporting bias. Random. These are the potential types sources of the bias. Limitations for the Article 2 focus on the short time, heterogeneity, side effects. Many trials were conducted over the short period of the timeline limiting and the long-term impacts. The heterogeneity, the studied patient cohort was not the representative for all the patients. Side effects, augmentation techniques can cause the self adverse effects affecting advance and the total results. Areas for the future research. There are three types: long-term efficacy and safety, biomarkers, and comparative effectiveness. Clinically meaningful effects. The study supports the use of argumentation techniques by demonstration that they can considerably improve treatment outcomes for the patients who do not react SSRIs. Based on the conclusion, the both studies present various pharmacological approaches. All show significant therapeutic benefits. Drawback included the need of the long-term data based on the inherent basis and the short-term concentration. Future research should prioritize long-term efficacy and safety trials, personalized treatment plans, and understanding of medication underlying process. Based on my studies, those are the references based on the both article. Thank you.
Thank you.